joining me this morning are my guests, Rachel Wright, Vaughan Gilmore, and Dr. Vanitha Pothuri. They are from Santa Maria Hostel, and which is one of Texas' largest multi-site residential and outpatient substance use disorder treatment centers for women. Today, we will learn about the programs provided to women recovering from substance use disorder and how they put women and their children on the path to recovery. Good morning, ladies.
Good morning.
How are y'all doing this morning?
Good, thank you.
Good. Yeah, I am really looking forward to this hour spending with y'all, talking about Santa Maria, all the work that you'll do. And this is the first time I have y'all on Chai Time, so there's a lot to talk about, a lot to discuss. And I hope we'll be able to cover everything this morning and, of course, raise awareness as well. So, Rachel, let's begin with you. Give us a brief history of Santa Maria.
Sure. So Santa Maria started in the late 50s. We've been serving women in Houston for over 60 years. And the initial organization was a home that acted as a halfway house for women, many of them who had aged out of orphanages. And so it really was housing as a priority for those ladies. Over time, the mission of the organization shifted to provide substance use treatment as that became more of a root cause to what services women were needing.
Okay. And so what population does Santa Maria serve?
So we serve over 6,000 women, children, and family members every year. 99% of those individuals are at 100% or below 100% of the federal poverty level. So most of the people that we serve do not have means to receive treatment or services another way.
Mm-hmm. Okay.
Yeah.
And so how can women who need your services contact Santa Maria?
So the best way is to visit our website at santamariahostel.org.
Okay.
If someone is in need of substance use treatment, there's a form on our website that they can easily fill out.
Okay.
They can also call Santa Maria, and our phone number is 713-691-0900.
So how did you get involved?
So I came to Santa Maria as a staff member, so I'm very new to this topic of substance use. So I'm very glad that Vaughan is here with me as the expert in that area. But I've been working in nonprofit fundraising and marketing for over 20 years, so I was excited to take on a new challenge.
And how has it been for you so far?
It's great. It's a lot to learn, but it's very rewarding.
Oh, that's wonderful. And so do you get to talk to the women out there, like have a one-on-one conversation with any of them?
Usually most of the women that I interview or have conversations with are those who have been through our program and have been out in the community or out, I hate to say out, but living in their recovery for a year or more. That would be the best way to articulate that. And then those are ladies whose stories that we like to capture and be able to talk about to the community so that they can see the great success that can come from living a life in recovery.
Oh, okay. I know I have seen a short clip on the website itself where, some of the women who have recovered, like their success stories, and they become part of helping other women.
Yeah, so I can tell you a little bit about that.
Sure.
So we definitely have women who might have successfully completed our program that come back to volunteer, or they might move on to get some type of certification, like a peer recovery specialist certification, where they use their lived experience to help other women, or sometimes they go on to get additional training and become licensed counselors, and then come back and work for us as staff members. I have, program directors or counselors that work in our programs that are graduates of our programs. We also just attract a lot of staff that might have lived experience with substance use disorder or recovery because they're so passionate about the work.
Yeah, and I know, like, even with other nonprofits, when people who have gone through they've, gone through struggles and challenges, and they come out doing fine, doing well, and then they give back that way. A lot of other people can relate to that. Then they're more comfortable, and even they're able to communicate and be a little open, because I'm sure it must be very, very difficult to kind of break that shell initially, right?
Yeah, unfortunately, there is a lot of stigma and a lot of shame that keeps a lot of people from getting help for substance use disorders and for mental health disorders. And so it can be helpful to have somebody walk alongside you that has that lived experience. To take some of the shame away and say, I've been there too. And even really, we find that one of the things that's so valuable about substance use treatment is the community setting, right? Being in a group of other people with that same experience. That really takes away a lot of the stigma, to sit with other people who are doing the same thing that you're doing. And so we use a lot of groups and a lot of peer relationships as part of our treatment programs.
Okay, so can you walk us through someone who comes to Santa Maria? What happens? What are the steps when someone just walks in?
Sure. So seeking treatment at Santa Maria, or really any substance use disorder treatment, typically starts with either the individual or maybe their family member reaching out for help. For us, we do that through an electronic screening form, like Rachel mentioned. For some treatment centers, it's a phone call, but sort of starting that process and inquiring. And most treatment centers, including at Santa Maria, are going to start with an assessment to just see what's going on. And part of a good assessment is getting a history of substance use, of physical health, mental health, goals, and then making a recommendation for what we call level of care. Does this person need to go to detox? Do they need to go to residential? Do they need to go to outpatient? So a clinical team member is going to make a recommendation based on that assessment, and then give somebody those options and say, here's what we're recommending to them and their family, and then help them get enrolled into that recommended program.
Okay, and speaking of programs, I know you'll have a lot of
Yes.
programs. So can you elaborate on the type of programs that y'all have?
Sure. So, we have a wide range of treatment programs. I think most commonly we're known for what is our residential women and children program, because that is so rare. So there's really only one other place in the state of Texas where women can go to treatment and stay there with their children or their babies. We also have just traditional sort of adult women substance use disorder treatment. We have detox programs. We have some justice involved programs as well for women that specifically are in the justice system. And they might be coming in as part of that program where they're required to be there. And then we also have outpatient services where you're just doing it individual and group therapy on Zoom. And then we have prevention and intervention services as well. Rachel probably can talk more about some of that if she wants.
All right. Go ahead, Rachel.
Sure. So our intervention and prevention services are designed for children and families, and we have services in 3 different school districts. We're in Aldine, Houston, and Spring Branch school districts, and one of the main components of that is an educational program called Strengthening Families. We find that when the family structure is strengthened, then the children are less likely to engage in dangerous activities such as substance use.
Okay.
So that's the root of that program and the prevention program. We've received some community awards for that as well.
Oh wow, that's wonderful. So how long do these programs last?
Yeah, it really depends on the it's so individualized. So treatment, substance use treatment should be individualized, right?
Okay.
So again, that assessment is helping to figure out not only what type of treatment does somebody need, but maybe how long should they be in treatment. So we have programs 90 days or more. Some women are in services with us between our treatment and housing for 2 years. And some just come do 60 days with us and then they go back to their regular lives and their support system. And so along the way, a participant should really be working with their treatment team to figure out, what do I need to do next? What does success look like for me? How long do I need to be in services? And in an ideal situation, somebody moves through what we call a continuum of care.
Okay.
So there's lots of research that a minimum of 90 days of treatment sets people up for better success. So we like to see our ladies stay at least 90 days if they're able to, because there's actual sort of research out there saying that that is more effective. But people also should be stepping down, like, so they might start in residential, then move to what we call supportive residential, then to outpatient, right, then to recovery coaching. So it's like a stair step down approach. You're starting with the most services and slowly reducing those services over time, because going from a very high level of treatment to right back in your family system or your community where you were using before often can lead to a recurrence of use.
Okay. And so has there been an increase after the pandemic?
In substance use,
Yes,
or in need for treatment?
I would say both.
Yeah. Yes, definitely. I mean, there's lots of community research samples showing increases in actually things like alcohol use during COVID and since COVID. Lots of people were using alcohol in unhealthy ways. We're still seeing that. There has definitely been a demand for services as maybe people have lost jobs, have less access to resources, may have become unhoused during COVID as well.
Yeah, because I know alcohol sales had shot up a lot during COVID for sure. People, I mean, they had nothing else to do, and then most of them were at home. So, alcohol was for some people thinking that's the other way, just to pass the time. Or,
Yes.
Yeah. So what should women expect or not expect when entering treatment?
You want me to answer that, Rachel? Yeah, I don't know if I can. I think at Santa Maria, one thing they should expect is to come into a stigma-free environment where they feel welcome, where this is a place that, regardless of the service that they need, that they'll find that, whether it's outpatient services, if it's residential services, they'll find a place where they can be at home. They'll find a place where their children can come with them into treatment, and where their children will be safe and loved and cared for. They can receive parent coaching as well for mothers of young children who are in residential services, as well as childcare for their child that entire time. So when they're with a counselor or they're in a class, we do have on-site and off-site childcare, depending on the age of the child. So that child is being loved, they're being nurtured, they're receiving treatment and care as well. And so I think that's one of the things that Santa Maria offering is an asset beyond where you would find in a lot of treatment facilities, is a place where your infant, small child, even school-age child is having programs and services and care given to them as well.
It's so great to know that the kids are taken care of.
Yes.
Yeah, for sure. And the mom has that peace of mind, at least, where their children are concerned, because many times they are not able to focus on themselves because of their child. Yeah. So in this way, part of that stress or worry is taken care of.
Yeah, I mean, a lot of it is really that support around what it is like to parent. And sometimes for our ladies, it might be the first time they're learning how to parent without drugs and alcohol involved. I think one of the reasons it's so important that we allow women to come with their children is when we look at research around why women don't seek treatment, one of the most cited reasons is their children. Right? Because they're worried about being away from them, right? I think about how hard it would be to be away from my children for 30 or 90 days, right? Or maybe there's no one else to care for them. And so it is a very common obstacle that women don't want to go to treatment because they don't want to be away from their children. So this is really taking away that barrier or that reason that maybe they wouldn't be able to seek treatment otherwise.
Okay. And so the services that you provide, is it only for people who live in Houston, or can anyone, I mean, we are on live, of course, and if someone is listening and needs help, are they okay to reach out to y'all?
Yeah, so we actually serve women from all over Texas.
Okay.
So we are a provider for the state of Texas.
Okay.
We get women from Travis County, from Corpus Christi, from Waco, from Beaumont, a lot of places where there are not these specialized services for women. And so they are looking for gender-specific programming or programming for women with children.
Okay, that's great. And why is this work important in the community?
So many reasons.
You should tell it all. Just say it.
I think it's really important for a lot of different reasons. I mean, targeting women and that two-generational approach, I think, is so important. Oftentimes it's not just one generation that is affected by substance use and addictive disorders, right? It is usually multiple generations. Usually by the time somebody comes into treatment with us, their parents, maybe their grandparents, multiple people have had issues with drugs and alcohol. And so we're talking about breaking generational cycles. We're talking about healing intergenerational trauma, and really intervening with mom and those children to set the whole family system up for success. And that's pretty unique.
Yeah. And what is the misconceptions usually when it comes to addiction to substance use? I know there are many, misconceptions on that. So let's touch on that as well.
Yeah, I think that's really important because oftentimes, working at Santa Maria, we do, like Rachel mentioned, tend to serve an underserved group of individuals. But I think there is a lot of misconception about who addiction can happen to. That it only happens to people from bad families, or that it only happens to, people who really are not taking care of themselves, right? There is a lot of stigma and misunderstanding about what sets people up for addiction. Unfortunately, it does not discriminate. It can affect people from all social classes, all over, right? It doesn't really matter what kind of family you came from. Addiction is a brain disease, so it's that repeated exposure to drugs that causes addiction, not somebody's lifestyle or their family. And so oftentimes we're educating people about what causes addiction. It's not a moral failing, it's not their family's fault. We really want them to understand that.
Okay. So are there any stats to, women, like if they are on the road to recovery, they go back, but then they fall back again on. So is there any specific stats to that?
So once somebody reaches 2 years of sobriety, their chance of relapse goes down significantly. Because around 18 to 24 months, we see the brain really start to recover, changes in the brain sort of start to go back to a more normal level of functioning. So oftentimes programs are trying to get people to that sort of first 2 years. It's not uncommon that somebody might need more than one treatment episode though. And then you go back to treatment and you try again because maybe you've learned something. So there's no shame in that.
Okay. I know we keep saying that there's no shame. We keep repeating that word because unfortunately that's what it is many times, right? So Vanitha, I have a question for you. So Vanitha, why are you passionate about the mission of Santa Maria, and what made you join Santa Maria, be on the board, advisory board?
So I came to know about Santa Maria when I was with the Indo-American Charity Foundation, and we had given them a grant, I think 1 or 2 years. So I came to know of Santa Maria through my work in other nonprofits. But I do, I think, kind of have a personal interest in mental health, even though I'm an internal medicine physician by background. A lot of, and I specifically work in a gastroenterology practice, but I do feel that there's a lot of biological and behavioral aspects that are tied together. What we will see, in our practice specifically, is the end result of alcohol use disorder or marijuana use disorder. So we're not dealing with, some of the more mental health directly aspects, but we're dealing with the more biological outcomes. So, being a physician, even though I'm maybe not a psychiatrist per se, but I do feel the biological and behavioral basis of, many addictions is strongly tied together. And in our practice, we see pretty severe outcomes of it. So in a gastroenterology practice, you'll see patients with fatty liver and going into cirrhosis. And once we have those types of diseases set in, they have not only the substance use disorder to deal with, but they also have a massive amount of actual physical disorder. And just I feel like we've also seen the healthcare burden come out of that too. So I just, in general, I have an interest in the biological basis for addiction, and also the outcome of it, the negative outcome. And also, I just in general am a mental health advocate. I feel that mental health permeates into all aspects of our lives. It's not just limited to depression and anxiety, which, when people talk about mental health, they zero in largely on depression and anxiety. Yes. But there's so much more that we could be talking about, and addiction being, one of those topics.
Yeah. And speaking of marijuana, there are many states that it is legal, not yet in Texas. What are your thoughts on that? Any of you ladies?
Personally, because there's several components that come out of the marijuana plant. So I wouldn't say all of it is necessarily harmful. There are some, CBD, there are some anxiolytic and pain relief aspects of it. But when you're talking on the THC side of the spectrum, the more hallucinogenic, and I would call that the more detrimental aspect of, cannabinoids. But there are some, benefits to the CBD side. I don't have a lot of direct knowledge in prescribing. I'm not a marijuana, provider, or I'm prescriber per se. But when people talk about the cannabinoids in general, I think people have to be more educated about the differences between CBD and THC, and that there is some potential benefit to the CBD side of the spectrum, but that doesn't just cross over into all marijuana use, point blank.
Yeah, I would add, I agree with everything she's saying. With CBD, one of the risks is really not knowing what you're actually getting. A lot of times when they test CBD, it has nowhere near what is said to be in it. So, one of the issues that comes with it really not being regulated is consumers do not know what they're getting when they purchase CBD or THC products, which can be very dangerous. I think one of the other important things for people to know is because THC does have psychoactive properties, if somebody has a history or a family history of mental illness, THC can be incredibly dangerous. It can lead to what we call early onset psychosis for young people. Actually, we have research to show the most dangerous time to use marijuana is adolescence and young adulthood. The most dangerous time, right? So if we're talking about an adult 40, 50, 60 over, that's not who we're the most concerned about, right? Not that they also can't have a problem, but we're the most concerned about young people using marijuana because of the way it can alter the brain and because of that psychosis risk that comes along with it.
Okay, well, that's good to know because I know that it is a big controversial topic to talk about, and I've had doctors who come on air as well, and saying there are benefits for it as long as it is regulated, and that is important. But we see so many kids, it's just been abused, right? It's just been, even though it's not legal, it's still out there.
Yeah.
And so I guess it is important in many ways to talk about it and to raise that awareness as well, because that's where it starts sometimes. You're just using it for just to try it, or peer pressure many times, for just silly reasons sometimes. So it's just important to do that. All right, so let's go on a short break, and when we return, we will continue our conversation. Time goes by so fast. Like, what's going on? This is Chai Time on 99.5 FM. Welcome back to Chai Time on 99.5 FM. If you just tuned in, I'm in conversation with Rachel Wright, with Vaughan Gilmore and Dr. Vanitha Pothuri. They are from Santa Maria, and we have been talking about the services they provide, the programs that they have, and we went a little, deep about even the marijuana use and things like that. So I wanted to ask you, Vanitha, what would you say to others to encourage them to engage with this kind of work?
Really, I think we have to destigmatize, not just substance use disorder, but I think mental health topics in general, and I want to say that it's, there's more shame, fear, and guilt in the South Asian community around these topics, but I think it's also a general societal issue too, right? The shame, fear, and guilt that follows certain topics in healthcare across all societies, but I think with some ethnic groups, and me being South Asian, I can speak to my own community, that there is, it's I think deeply ingrained in who we are, and I feel like a large part of that conditioning comes from our childhoods also. Our childhoods, our family systems, what's deemed appropriate, what's deemed not appropriate to speak about. One thing I've noticed in the South Asian community is there is quite a bit of family dysfunction. And, things like substance use disorder, I think Vaughan had touched upon the biological basis for it, that there's genetic and epigenetic studies where things do get passed on from one generation to the other. So in medicine, we take family histories, as very much as a part of our initial intake, because, whether it's diabetes or high cholesterol or substance use disorder, these things oftentimes are passed on. So the genetics of it, is passed on from one generation to the other, the biological basis. And then you have the activation of those genes, right, as a secondary component. So interestingly, in our practice being gastroenterology, we do have some patients of ours that come in that, say have a strong family history of alcohol use disorder, that they've made a life decision to never have alcohol because they feel like maybe, I don't know if they've researched it themselves or they just have a observational understanding, based on what they've observed with family members or what they've experienced, the negative aspects of, a father or mother being alcoholic or a grandparent, but they've made a conscientious decision that I know I have this strong genetic basis. So I'm going to make a life decision to not ever drink alcohol. I don't want to take the risk of turning on that gene expression. So, but in our South Asian community, I feel like destigmatizing a lot of these topics is very important. Because I feel like, in our community, we try to segregate things into normal and abnormal. And if you have a genetic family history of substance use disorder, I think maybe normalizing some of that terminology and the understanding within your own family unit is important, because that may impact future generations, right? And also remodel the genetics for family lineage also.
Yeah. So it is important, like you said, because there are so many things within, bless you. There are so many things within our own community that we really don't talk about, and I know things are changing, but they are changing slowly, very slowly, and which is a good sign. But it needs to be, we need to really focus on talking about topics like this just within our family, or because kids sometimes also need that guidance. They don't know, and if we don't talk to them when they're home, and we don't know, because now even with kids, for instance, it's all about privacy, and it's all about they it's their own private life. We don't ask those questions. Even with the young, the devices, right? Everyone's on their devices these days. So we sometimes lose that touch with our own kids. And I guess even we don't have that knowledge. So to educate ourselves first is important. Yeah. So why is mental and behavioral health important to physical health?
I mean, I think we've touched
Touched
upon this,
on that.
but I think that it really goes hand in hand, and there's a lot of neurohormonal factors that are tied into this. I think Vaughan and Rachel had talked about the women. Oftentimes they'll go into a treatment program, but then go back into that same environment, right, and trigger that cascade of either seeking out dopamine, or your stress hormone levels go up. So you're basically triggering and re-triggering those cascades, which, I mean, just talking about cortisol alone, that wreaks a whole host of issues on the physical body as well. So I don't think we should separate mental health and physical health, in my opinion. I think that mental health is physical health. So I'm not sure where that divide came about. But I hope in the future we can bring it back together, because,
Correct.
the person's a holistic person. They're not separated into just their mind versus their body, right? Our mind and body are tied together, whether you're just looking at it from a pure scientific standpoint, or whether you're looking at it from a spiritual standpoint. Whatever your perspective is, it is one and the same. I'm not sure where that divide came about or how it came about entirely. But, even in medicine, the field of psychiatry largely for many years was separated out, in some ways, where you had the practitioners for the physical part of it, but then you had mental health practitioners. They were like kind of a subgroup on their own. Nowadays, I feel like it's getting more integrated, but I think going forward into the future, I hope that they don't view it any differently. So in my opinion, mental health is physical health, because there's a lot in the background that's tied together.
Yeah, that's true. And I guess the word mental itself is very daunting for a lot of people, because they think, I'm not crazy, whatever's happening to me. And I've heard so many stories about that. We did a whole series on mental health during Mental Health Awareness Month, and hearing those stories, because we don't know what we cannot differentiate sometimes, and it is so hard. And I think many times also we think, oh, if I say this, like I'm thinking of this and I'm going through depression, or something's happening to me. Sometimes we don't even talk about it because we are afraid of the judgment. And many times that happens in in society itself, because then you have that label, I guess, right? So it's hard. It's difficult. Okay, Vanitha, so what would you want people in the South Asian community be aware of about substance abuse and behavioral health?
I think that our community needs to wake up a little bit in terms of having more honest conversations about the statistics around substance use disorder. And I haven't looked at all the studies, but I tried to, touch upon a couple of sources that say that we have about 3 million in the U.S. of South Asian background identified substance use disorder. There's probably a lot of that are unidentified as well. So, which I feel like even just the identified population is large. So large enough where I think as a community, we need to be talking about this more. And, just like we've spoken about in, a couple of minutes ago, I think talking about a topic more, actually, and learning the terminology behind it, and learning the basis for it, and learning what are the concrete solutions to us individually, our family units, and our society, helps remove that stigma. Okay. I feel like a lot of times we overly stigmatize things and give it more power than necessary by not having those conversations. Then I feel like the shame, fear, and guilt actually take on more power. Being able to, I even think, maybe screening, better screenings for patients, as we have a lot of physicians and other NPPs in our South Asian community. And a lot of those providers do have a heavy South Asian population. So, perhaps having better screening, right?
There are evidence-based like screening programs and protocols out there for screening for substance use and risk. One of the things I was going to add in terms of creating more open conversation around this is it really can influence the outcome. So, one of the things we know about substance use disorders is they are progressive diseases, right? So the longer somebody struggles with it, the more deadly it becomes, the more consequences to their health and their life somebody's going to experience. So creating more openness to be able to have these conversations with family members, with children, so that intervention can happen earlier is actually really important. The sooner we intervene, the easier it is to help someone do something about it, versus the longer it goes on without any intervention, without any help, the more complicated it's going to get for that individual, and the greater the risk that they will actually die from this disease.
Mm-hmm. So are there any, what do you call it, like events or anything that you all have that, helps with educating the community in terms of talking about substance use?
Sure, we have a few events. We do have an upcoming Faith Leaders Breakfast that Santa Maria will be hosting for people of all faith backgrounds who represent faith communities who want to get more involved with us and also find out what kind of education we could help provide to their faith community. Okay. And that event is coming up, so folks can get on the website and contact me about that. I'd be happy to chat with them. We also have a major fundraising event every spring. This is slightly different. It's not so much as a marketing or informative event about our programs, but one that helps us raise money and awareness for Santa Maria to keep serving women in the greater Houston area.
We also participate in community events like Rally for Recovery, other sort of community partnerships that are really focused on creating awareness. And then our prevention team is in the schools doing a lot of this sort of intervention and education as well.
Okay. And can you share some success stories with our listeners?
Sure, I'd be happy to. That's one of the most fun parts, right, about Santa Maria is being able to sit down with an alumni and hear how she's been able to move on in her life and just be successful in our community and really give back One particular alumni comes to mind, Kaylin. She had been a participant in our Women with Children program a few years ago. She had 2 school-age children, and it was discovered by a social worker who she had reached out to for financial assistance with school supplies and different things. And the social worker quickly discovered she needed this assistance because she had a substance use disorder. And so Kaylin found herself, unfortunately, in a position where Child Protective Services was becoming involved in her life. And she was just absolutely driven to do anything possible to stay with her children. And fortunately, the caseworker she was working with was like, Santa Maria is the place for Kaylin. This is where she can get the help she needs. She can stay with her children. And Kaylin dove into our programming with her whole self, with a desire to beat substance use disorder, to be a healthy mom for her 2 kids, which she very much is today. Today, Kaylin is a peer recovery coach in our community, helping other women. She doesn't work for Santa Maria, but that's okay. We're still happy for her. Her children are now extremely successful in school. They do extracurricular activities like choir and taekwondo. She volunteers with her local faith community that she became involved with while she was at Santa Maria. So that's one of our success stories that we like to point to. Kaylin's story is very representative of the women that we serve. And so it's just, she would just tell women coming into our program, just do it. Even if it seems silly at the time, just go to all your classes, take everything in. If Santa Maria offers a service to you, you probably need it, right? And so she's, that's really something that she echoed to me when I was able to sit down with her.
That's great. That's such a wonderful story to hear from where she started and now where she is. And she's helping so many too.
She is, and she's completely bilingual, being from Central America herself. So that's also a huge need, is the need for bilingual employees in the recovery community. So that's a huge benefit that she brings as well.
Vanitha, do you think like where where doctors are concerned, should they also be more, like get involved, like in the sense, like be more educated about things like that, or how to be, get more awareness as well?
Definitely. I think that, if you want to kind of talk a bit about this on a more scalable level, I think, educating the people that will screen and identify a lot of the potential clients or patients is, I think, probably a very practical approach, because reaching the end user is more difficult than educating the first line person that's going to see a patient in general. And then, but the patient's not going to come and tell you, I have substance use disorder, right? They're going to come in for diabetes, high cholesterol, abdominal pain, right? But it's an amazing opportunity to screen for, like we screen for colon cancer screening or breast cancer screening. I think mental health screening should just be part of any, routine primary care visit, be pediatrics or on the adult side. Even on the pediatric side, the family, the parents could have mental health issues or a mental health diagnosis or a substance use disorder diagnosis, which then is an amazing opportunity to be proactive and educate the family, perhaps get treatment for the parents themselves, but educate the parents on how are we going to not carry this forward into your children and their children.
Yeah, I do think there's a lot of opportunity for providers to be screening and asking these kinds of questions in a way that invites honesty, right? Even just as simple as, you're not drinking alcohol, are you? Right, versus how many right, are you right, asking these questions in a really inviting way, providing education. There is a program out there called SBIRT. It's called Screening, Brief Intervention, and Recommendation to Treatment, or Referral to Treatment. But it is a very easy to get free training on for any kind of primary care, nurses, physicians, providers. Anybody can participate in the SBIRT model and then be able to make those recommendations. It trains basically on how to ask those kinds of screening questions in any kind of healthcare setting so that people end up sort of referred to the right place. So the resources exist if there is interest in it.
Okay. And what about schools when it comes to teachers and...
Yeah, I mean,
well.
I do think that there is lots of intervention happening there in terms of school counselors, school social workers. I mean, we've had situations where it was the child's school counselor that recommended that mom come into services for us. Okay. So, you know, we actually saw, like, during COVID, right, because children were not in school, they weren't sort of getting screened. There was no one monitoring them. A lot of things maybe were missed during that time. So I do think that there is screening happening in schools when it comes to sort of the safety of the children, but maybe not as much around sort of primary care for adults.
Okay. All right. That's good to know. So how can the community get involved? Rachel?
So the community can be involved with Santa Maria in a number of ways. Okay. Of course, helping financially is always a great way to be involved. Hopping on the website and giving any kind of monetary donation just helps us to be able to pay our staff and to, you know, keep things up and running for Santa Maria. We also have volunteers that come on our site, whether it's a group, you know, a school group, faith community, even a corporate group, come and do volunteer work on our site. We also work with a large number of individual volunteers, and the training is a bit robust just because of the sensitive nature of what we do at Santa Maria, but we do welcome individual volunteers to come and be a part of our community. Anything from rocking a baby to sorting clothing items in our non-transactional store, or sorting shampoo, conditioner in our basic needs closet. We use a lot of what we call gift in kind, which is gifts of objects, as opposed to just dollars. So if anyone wanted to do a drive at their business or at their faith community to help us out, that would be greatly appreciated. We're always in need of women's hygiene products.
So if someone wants to donate, you know, the basic needs, and if they just want to order online or something, can it be shipped directly to y'all?
Yes. Unfortunately, we no longer have a wish list with Amazon, but anyone can get on any site like Amazon or DoorDash even, and just if you can just put those items to my attention, Rachel Wright, or even attention donation is fantastic. And we're always in need of body wash, shampoo, conditioner, anything like that.
Leggings, new bras and underwear. You know, I mean, because I think to this point, it's really important that our participants that come through services with us pay nothing to be there, right? That they typically are coming with almost nothing with them, and there's no cost for them to receive services with us.
Okay, so that's good to know, because I know there are a lot of people who are listening. Many of them, after the show, they sometimes reach out to us, and you know, they're like, hey, you know, I'd like to donate some basic needs for women, for children. So that's good to put it out there for anyone who is interested in doing that. So before we wrap up, any message to our listeners? I'll start with you, Vanitha.
I'll make a comment specific to the South Asian community. I think that we can definitely have better screening tools in place for practitioners, because I think in the South Asian community we tend to compensate very well, and we're very high functioning. A lot of South Asians came here on the basis of education, so somehow we've, you know, managed to keep it together and so you don't see maybe the indigent side of substance use disorder. You'll see the high functioning side. So I think we can get very easily tricked by that.
Okay.
And I think that's just something for South Asians to keep in mind.
Okay, that's great.
We're just really grateful for an opportunity to share about the work that we do at Santa Maria and just give a voice to this issue in our community, and just really appreciate whatever the listeners can do, whether it's sharing what they heard today or whether it's engaging with us in some other way. But just being aware and knowing is a huge opportunity.
Thank you.
So I think the last thing that I will share with your listeners, we've talked about alcohol, we've talked a little bit about marijuana, we haven't really talked about the opioid crisis, and really what is sort of the fentanyl crisis now. And I think that is something for people to really be aware of, to be talking with their family members and their young children about. In terms of it, with fentanyl on the streets now, it really only takes one time for someone to overdose and die. Fentanyl is 100 times stronger than morphine. It has infiltrated almost every substance that people are purchasing illegally, whether they might think they're purchasing hydrocodone, methamphetamine, cocaine, ecstasy, any of the things that people that think they're purchasing on the streets now, when it's tested, has fentanyl in it. And it is, killing Texans and people around the country at a rapid rate. And so the health risks and the life and death situation there is really important, that it only takes one time.
That's so disturbing.
It's terrifying.
It is.
People should be scared.
Yeah. And I know this is not the last time. You guys, you ladies, we would love to talk more about that, go into more in-depth conversation into that, get people to learn more about it as well. So I would love you all to come back and talk more about any sort of drug or substance use. That way, the more awareness we raise together, the more we are helping our own community, and that is so important. Thank you so much, ladies, for joining me here on Chai Time. This has been such an eye-opener for me too, learning about Santa Maria, and me being a small business owner. I'll be very happy to support you all, partner with you all in whatever way we can as well. And anyone who's listening would like to support and be, help and be part of Santa Maria, do reach out to them. We will share their contact on our website, on our page as well, and that way people can reach out. So
Wonderful.
Thank you. Thank you. Thank you, listeners, for joining us here on Chai Time. We shall see you next week. Same time, same place. Signing off, Chai Time on 99.5 FM.